Grinding of teeth is actually called bruxism, and what bruxism is, it's involuntary. You can't help it. You do it when you're under pressure. When you're, some people bite their nails, they pick their nails, they scratch their ears. It's an involuntary habit. It's like a nervous tick. Except the thing about grinding your teeth is that we tend to do it. Well, you can do it during the day, and very often you do it at night. And it's interesting. I myself suffer from that. I do that a lot myself. And the way I know I grind my teeth is because in the morning I get pain next to my ears where the jaw joints are, and you get pain on the side of your head. And it's remarkable how in some cases, and I stress some cases, when a very, very simple appliance like a sports gum shield, in fact you can try this yourself with a sports gum shield, and you have a sports gum shield and you wear that instead. You mold it to your mouth. You're going to get a better one if your dentist makes it for you, and you wear that overnight, and it basically acts as a shock absorber, and so these forces are not pushed around your facial and head and neck musculature, and it's really a very, very common condition. And I must say, as I say, I see a lot of that right now. Of course, the other more obvious result of grinding your teeth is, in fact, that you wear your teeth and you break your teeth. If you have large fillings in them, you put pressure on these teeth and you literally wear them out. And, of course, when a tooth is worn out, that's it. It's worn out forever.
Why do you have to use fillings?
Well, fillings, basically, what is a filling? A filling is a repair to a tooth. A tooth gets damaged. A tooth gets damaged by dental decay. Dental decay is caused by sugar. That's it. Nothing else causes dental decay. You get decay, what are you going to do? If it's spotted early, now it's not painful to get decay. If it is painful, you've left it late. You've had decay for almost a year. Historically, we were unable to when I say historically, like more than 100 years ago, we're not able to actually cut out a portion of the tooth and leave the rest of the tooth intact. So now, with technology and stuff, we're able to anesthetize the tooth, make the tooth numb, cut out the decay, and insert a filling material that's compatible to the tooth. And traditionally, in excess of the last 100 years, the material that was found to be most easy to use and most compatible and most accessible was dental amalgam, i.e. silver fillings. And basically it's the simplest thing to do. You cut out the decay, you try to leave as much of the tooth intact as possible, and then you have to create a retaining wedge or shape within the tooth, and then you stuff this metal paste. I know it sounds strange to have a metal paste, but that's what the mercury does. It basically creates an amalgam which starts off soft and pasty. Shove that into the hole, and then you burnish it and smooth it. And then over about 24 hours, it hardens. The filling isn't glued to the tooth. It's stuffed whole. So that means you're always going to have what we call a micro gap between filling and tooth. That micro gap, over a period of time, allows bacteria and allows leakage down in between. And so after a period of time, these fillings need to be replaced. But today, since the late 80s, well, actually a little earlier than that, but since the late 80s when they were getting much better materials in, we're using composites, white fillings. The major difference there being that these white fillings are bonded into the cavity that you prepare. First of all, you can cut a much more conservative preparation. You don't have to cut away so much tooth to put a filling in place. You can cut a conservative preparation, and you're effectively putting a tooth-colored glue into the tooth. Looks good, feels good, very, very strong. And have your kids from the age of 6 and 7 upwards, as the permanent teeth begin to come through, have the surface of the back teeth coated. Imagine you're varnishing a surface of wood to protect it against the weather. Same thing. We can do a thing called a fissure sealant, is we seal the parts of the teeth that are most susceptible to decay, and we seal it with a special varnish. And that I recommend every single kid from the age of 6, 7 years old upwards. You know where I find a lot of cavities with adults, people, the age of this person texting in, is sports people, sports enthusiasts. Why? They take all this Lucozade, they take all the sugar, they take all the glucose. Same stuff.
Stop. You're killing me here. You're killing me here. I love Lucozade.
Fine. But when you have the Lucozade, have water after it. Get the sugar out of your mouth. Wisdom teeth, the third molars. We have we get another molar which is supposed to come through at about age 18. Everything happens in sixes in dentistry. By 6 months, you're getting your baby teeth. 3 to 6 months. By 6 years old, so you have your baby teeth up until 6 years old. By 6 years old, you begin to lose baby teeth. And your first big molar comes in. By 12 years old, i.e. 6 years later, you have your second molar coming in behind the first molar. And it's usually pretty much like clockwork. That timing is usually quite accurate. And then by another 6 years, age 18, comes in behind that again. And the thinking, well, when I say thinking, the development concept here is that as the mouth and the jaws and the head grow, there's space for more teeth, so more teeth come through. And the wisdom teeth are the last 4 teeth that happen in all 4 corners at the back, usually by anywhere between age 15, 16, 17, 18. Now, for the vast majority of cases, you don't have enough space in your jaws to accommodate those teeth. And so they get stuck. It's like putting 12 dominoes into a box that holds 10. 2 more domino pieces want to come in, but there's just not enough space. So if they squeeze their way in, it's going to cause a buckling of the other domino pieces. So in other words, you can get crowding of your lower front teeth caused by the wisdom teeth that are unerupted at the back. That can and does to a certain extent happen. Is that the end of the world? Probably not. But what's much more inconvenient and much more draws a lot of attention as well is that when these teeth get stuck, they get jammed up against the back teeth. They can cause decay, they can cause damage, they can cause resorption. And very painfully sometimes, all of those things can cause pain. And it's damaging teeth that are already in place that are very useful that you don't want to lose, namely your second molars. So the wisdom teeth or the third molars are causing damage to the second molars, which have been there since age 12. Now, sometimes there's a little bit more space, and so the teeth come in part of the way. But they get stuck. There's just no way they can come out. It's like trying to put an orange into a bottle. The space is just not big enough. Now, so if it comes out half of the way, now all of a sudden those 300 different species of bugs that you have in your mouth have access to that partially erupted wisdom tooth, and it can cause an infection. Not can, it almost always does. And that infection has a special name. It's called a pericornitis. And that infection, believe me when I tell you, I've had the personal experience myself, can be unbelievably painful. And it can bring you to your knees. But now think about it. You've got tooth right at the back of the jaw, so the access is difficult for your dentist to get to. You've got a tooth that hasn't erupted all the way, so that means the tooth is sitting deep. Well, we have a couple of vice structures in the bottom, right below these teeth, and namely the nerve that is the nerve supply to these teeth and indeed the muscles of your lower part of your face. Well, you start digging around the back of your mouth trying to get a painful wisdom tooth out, you can cause damage to this nerve. And for that reason, we've got to be very, very careful as dentists when we start looking at removing these teeth. I have a couple of kids actually who don't have any permanent teeth, which is very strange. That's like 1 in 200,000 people have that problem. That you have 60 to 100% of your permanent teeth just don't exist. They just never form. And so right into adulthood, they go into adulthood with baby teeth. Again, that's extremely unusual, and I'm just saying that as an aside, but it's not uncommon to have premolars missing, or to have, or indeed wisdom teeth missing. Now that's that's a problem that I would wish on you. You don't need wisdom teeth. It's kind of like if you're born without an appendix. So what? We don't need the appendix. When decay gets into a tooth and it damages the tooth, when it advances towards the nerve of the tooth, there comes a point when it eventually breaches the nerve and it gets into the nerve, and you have the most unbelievable toothache. Now, how do we deal with that? You present with this problem, either the dentist sees it, shows it to you on the x-ray, or you're saying, this one here is killing me, do something. And they're begging me to take the tooth out, and obviously, very often we have the option to fix the tooth. The way we fix it is by doing a root canal. Obviously, we remove the decay, but the nerve is damaged. The nerve has to come out as well. So it's rather like taking the marrow out of a bone. So we make a hole, we clear away the decay, and we get what we call an access cavity. And into that, we then put a pipe cleaner. a file, a long straight file that's flexible because the roots are curved as well. So insert a file inside the tooth. It's not painful, by the way, because you're numb, and we clean out the nerve tissue, which is what's causing the pain. When the canals have been cleaned out, you've got to hollow it out, you've got to shape it, you've got to sterilize it, make sure there's no infection, and then over the next couple of visits, we fill up the canals with a special root filling material, and then we seal it, and then we put a filling over the top of that. Usually, teeth that have had root canals require to be treated with a crown. A wisdom tooth does indeed cause discomfort. There are various techniques, various instruments, various procedures that we use to minimize the trauma of the tooth and the surrounding structures, to minimize the pain that comes afterwards. We generally don't want to be taking a tooth out, wisdom tooth or other tooth, regardless, when you have an infection. If you have an infection, there's a possibility of spreading that infection and thus causing pain. Spreading the infection a minor amount is not a big deal. It will be cleared up with the antibiotics, but it can heighten the level of pain. If you're presenting in extreme pain, the likelihood of pain being there for a little bit of time after the procedure is also increased. The way the tooth is removed, the instrument and the equipment that is used. Very importantly, if you know that a tooth is going to come out and you know that you're going to have a procedure done, take a painkiller before. It doesn't make sense to wait. Take painkillers consistently and on time. It minimizes discomfort, it minimizes infection, it minimizes inflammation, and it helps you along. But yeah, so if you have a missing tooth, you want to replace that. Why do we want to replace the tooth? Other than the obvious aesthetics, we want to replace the missing tooth because as soon as you have a missing tooth, the tooth behind and the tooth in front drifts towards that space. So it creates spaces elsewhere. When the teeth drift, they don't drift in a straight, like completely upright. They tilt, like palm trees falling towards each other. So what does that do? That causes food traps right at the fulcrum, right at the base of the tooth. It causes a food trap. You can't brush in there so easily. So bacteria stays there. You get gum diseases right at the neck of that tooth. The next thing that happens when a tooth has been lost is that the gum and the bone shrink away. It drags gum and bone away from the neighboring teeth. In addition to that, the opposing tooth is rendered useless. When it's rendered useless, it over-erupts. It's got nothing stopping it from growing into the space. That takes longer. That takes anywhere from 8 months to 1 year. If you've had a missing tooth for years, it may not be possible to replace that tooth because the opposing tooth has occupied the space already. And now we have to damage a perfectly healthy tooth just to replace this missing tooth. The simplest way of doing an immediate replacement is with a denture. Dentures are good in that they're quick, they're inexpensive, they're fast, you can have the problem solved right away. One step up from the metal frame denture is to have what's called a bridge. You use the neighboring teeth on either side to support missing teeth. In some cases, you can do what's called a Maryland bridge. So we don't cut the teeth on either side, we glue a wing on either side to hold the bridge in place. Ultimately, of course, the single very best thing you can do is to put an implant. And an implant is an artificial tooth root replacement. The artificial tooth root, made out of titanium, is surgically inserted into the socket.
I have a problem with persistent bad breath, even though I have regular dental checks and use mouthwash night and morning. Even chewing gum does not help. What can I do to enjoy good breath?
There can be a number of issues. Obviously, it is not an issue with the teeth or the gums. It could be an issue with the tongue. I would recommend brushing your tongue as well. I would consider what it is that you're eating. If it's beyond that, you may have some digestion issues. If digestion issues, then certainly that you're regurgitating. You're regurgitating your stomach contents. Your stomach contents is digested food. Obviously, that's going to cause bad breath. There could very well be bigger issues than that. And by the way, don't forget, garlic and raw onions in particular cause the worst breath. So, and these are healthy things.
Yes. What kind of toothbrush is advisable? Soft, medium, or hard? And does the hard one damage enamel?
I prefer that you use medium toothbrushes. Nobody should be using hard toothbrushes. I don't believe hard toothbrushes should be available. They shouldn't be made. They shouldn't be sold. Soft toothbrushes or medium. If you haven't been brushing your teeth in a while, your gums are going to bleed. Face it, it's a fact of life. That's what's happening because you haven't been brushing your teeth in the first place. If it's bleeding, brush where it's bleeding. That's critical. Which type of brush? What? Don't care. Use one. Medium. I don't want you using a hard toothbrush. Use a medium or a soft. Don't give kids massive toothbrushes. Give them small toothbrushes.